Hi guys, it's Katya from FitInMobility, and let me pop a question. Can you actually fix a herniated disc? I have a very good news for you. Yes, you can. I hear this question a lot of times from my patients, and I have even greater news. You don't actually need to do a lot. We are talking about some light exercises, some spine mobilization, and what you can actually do. I'm going to show you in this video, so stay tuned. First thing, we're gonna look at our intervertebral disc. What actually is the function here? It has to eliminate all the burdens and all the shocks that are coming onto our spine during the day, right? So no matter what you're doing, if you're jumping, if you're running, if you're pushing, if you're carrying, all these burden, all these shocks needs to be absorbed. And this function like a sponge, because when you press a sponge, all the water and all the nutrients, also now here, all the water and nutrients goes out. And when the shock is eliminated, the disc can come again into its neutral position and it can suck again all the nutrients and all the water. So we already said the main component of our disc is the water, but because of our work, mainly this is one-sided positions all the time. Back posture, because while you're working, you're always leaning more or less in front, like this. I'm gonna exaggerate now, but see what is happening. The disc is squeezed on one side, and this burden taking so long, days, months, years, what can happen, the disc can crack because the disc has on the outside, the ring is a little bit more harder fibers, and inside is a little bit more jelly substance. And what is happening, this outside ring cracks and this jelly substance is slowly coming through this crack, and it can squeeze a little bit, compromise our spinal nerve that is coming out of our spinal cord, and this is pretty painful. But don't worry, not all lower back pain is alarm already for a herniated disc, because many people are afraid and they are thinking, oh my God, I have a herniated disc. No, there are mainly three characteristics you need to consider. Very weak extremity, very weak muscle force, sensibility loss, that means you feel numbness in a leg, you feel tingling, there is a loss of sensation if the case is severe, and the loss of reflexes. Okay, so don't worry, you need to fulfill all these three characteristics when we are talking about herniated disc. When do you know that you need to go under the knife? The stuff is serious when you don't feel that you need to go pee, so the water just runs and you cannot hold it. This is a serious stuff, so you need to consider your doctor, and maybe this is a cause for operation. But in all the other cases, we can do a lot of things. So herniated disc takes about 3 to 6 months to heal, but you can push this process, you can encourage this process with a little self-mobilization, with a spine decompression, with light movements, and we are gonna do this just now. So the first exercise is a very simple one. I love this one. I'm a huge fan of mobilization. So we're gonna decompress our spine. Take one pillow because it's easier for the stomach, and you're a little higher, and then just lay like this. I have this table here. You can use a couch, you can use a bed if it's a little bit higher, and just go like this. Drop your pelvic, drop your feet. There is no force in my feet. I don't push back. So everything needs to be loose and relaxed. And just hang like this for half a minute, for 1 minute. You can extend it for a minute and a half. And this will give you a nice lower back, lower spine decompression. So the second alternative to the first exercise is just grab your door frame. This will give you a nice spine decompression as well. I personally prefer the first option. Don't tell anybody, but I don't have so much strength in my arms. But if you do, you can hang like this 20, 30, 40 seconds. This will give you a nice decompression. You can repeat this 2 or 3 times. And many people also have some pull-up bars, some fitness rack at home. You can use this as well. If you don't have this, a simple door frame will do just fine. You know, sometimes people, when they have pain on one side, they are leaning against this side. So sometimes my patients are coming into the office or into the praxis and they come like this, oh, you see, but they actually have a pain on the left side. So what we are gonna do, we are gonna reverse this now. We're gonna lean actually not against this side, but towards the painful side. So you need a door frame, you need a wall, something to grab on. And I'm gonna just step like in the middle, have a little bit like 20 centimeters space from the wall, and we're gonna lean on our painful side. Now I have a pain on the left side, imagine this, and you're just gonna start by pushing your pelvic towards the wall. And you can repeat this slowly. Don't go into the pain, just relax and listen to your body. And with each move, if you can push a little bit more further towards the wall, if you feel comfortable, of course. And repeat this 10 to 15 times. And maybe after many repetitions, you can actually then lean with your hip, with your pelvic on the wall. We're gonna try to push our disc inside into our neutral position. So 10 to 15 times and then relax. The next one is the simplest as can be. Everybody knows this. You're just gonna put your hands on the buttocks and slowly extend your back. Again, don't go into the pain, just be comfortable in this exercise, and with every repetition, if your spine allows it, go just a little bit more into extension and repeat 10 to 15 times. So this exercise has the second version. It's a very simple one. You're just gonna go on the floor in your pace, in your style, and you're just gonna go like this, lay on the stomach, and the simple thing you can do, start like this. With this move, this is a moderate spine extension, and if you feel good with some repetitions like this, then you can extend it further, and you're just gonna go like this, stretch your elbow, and come down again and again, 10 to 15 times, and relax. For me, for my patients, I like to do only this thing because this gives you a moderate spine extension and it feels just enough for this type of what we want to achieve. So for the last exercise, you're gonna knead your bed and we're gonna just lay on the bed, slide down with your pelvic, drop your pelvic down. This will give you a nice spine decompression as well as spine extension. I like to combine with my arms like this and just hold in this position for a minute and a half. This is very, very relaxing. And then after a minute, you can combine with lateral flexion left and right, 5 to 10 times. And that's practically it. It's very, very simple, and it's so simple that it's actually one of my favorite ones. That's it, guys. Thanks for watching. I'm hoping that these exercises will help you. Let me know how you're doing. I'm very curious, and if you are interested in some more of the similar topics and home rehab videos, subscribe to my channel so we stay in touch, and I'll see you next time. Bye bye.